you're consuming data in 1 minute or 30 seconds. So that's also playing into our attention span, and data has already shown this. There's some people, as long as you're away from your device, you start to feel anxious. What is going on? So you're taking a photo, and then you will ask yourself, where's my phone? And you start to panic, and you're using the same phone to take a photo. So there's some level of anxiety that is starting to develop when we are away from our phones. Of course, I heard you guys mention cyberbullying, and I think this has become very prevalent as technology has continued to move around. A very common terminology I'm starting to see in the clinical practice is doom scrolling. In fact, Albert, I was hoping people would have mentioned that. And you typically see this a lot in anxiety and depression. So people who struggle to get out of bed, and you can stay in bed for hours just scrolling and scrolling and scrolling. You're not really consuming something actively, but it is, if you hear signs of those, you may want to ask if this person is depressed, this person is anxious, because those are actually some of the things we are starting to see. And then no surprise, a lot of information overload. If you just enter the front page of Google, depending on how you've been playing with your algorithm, you will be sold a house by Savo. You will see what Trump is doing in America. You will also find out what some of our local celebrities are doing, as well as what is going to happen in our tax budget or our tax cuts. All of that you've consumed in 10 seconds, 20 seconds. So of course there's an information overload. And then there's a problem in terms of literacy, because sometimes it's hard to distinguish which information is true and is not. And we saw this, and I tend to see this a lot when we have issues like COVID. During the COVID pandemic, when there was no news, every news is now news. So that information overload was actually contributing to anxiety. And then finally, and this is on a larger scale, when you work with populations that are more low income, you actually start to see that digital divide, because people who come from lower income homes don't always have access to their own mobile phone. They will have to rely on parental controls or parental access, but people from higher income homes are likely to have phones, and that will also impact their digital habits. So those are just some of the things we've seen, especially for the young people, and I'm focusing on them because we've seen that's where consumption is at its highest, right? So I was told to talk about policy to practice, and to do that you have to see where the gaps are. So I was able to identify perhaps 4, there could be more, but 4 gaps in terms of policy to practice. So for one, if we're talking about education, health, and labor, all of those are different ministries in our country, and sometimes work very siloed. So when you want them to do something cohesive like digital well-being, then who is going to do it? Who's the custodian? How do we determine, is it labor who does it? Is it health? Is it education? So those kind of silos have become problematic. Then once we actually figure out who will do it, there is implementation challenges, especially for the youth. As long as you're developing something for the youth, you have to consider their community, which is where the youth are. You have to consider their immediate household unit, which is the family, as well as the teachers, the people who they have access to. So if we don't integrate those to those communities, then we actually create gaps. And then we've also seen that these responses are more reactive than preventive. So what's been happening on the media of late, most recently? We have a gambling pandemic, right? Is that preventive or reactive? It's reactive. We've always had a gambling problem. So those are some of the challenges that we're having. And then finally, and I'm a blind optimist where this is concerned, right now we are importing a lot of solutions. So the innovations are great out there from China, from Japan, from the US, but we need to come to a point where we are developing our own local framework. So when we have people like Albert who have training and expertise on digital wellness, then I look forward to a time where our innovations will be our own. All right, next. So I did a mini, I would call it a SWOT. If we want to figure out how to integrate for the 3, there have to be some things that are working and some things that are not working. So I know this slide is a little bulky, but I will just go through some key things so that we can be on the same page. So education, I know we have issues with the CBC system, but any system for you to really see how good it is, we need a little bit of time. That's impact. We need a longer duration to see. We have ICT policies in place, and we have learning hubs, even though they are not everywhere. Within health, we have networks that have been brought down to community health promoter level. Again, I know there are challenges with that. We have a lot of tech health. I think Dr. Jean mentioned that earlier. Now we are a lot more woke when it comes to mental health, and telehealth is also expanding. And then when it comes to the youth, there's a lot of good youth initiatives, YIDP, you must be one of them. Entrepreneurship, and we have a lot of digital innovation. So those are some of the strengths that we see when it comes to education, health, and labor. But we are having challenges which, if you pay attention, are similar. In education and health, we have issues with resources, we have issues with healthcare worker. The gaps, the ratio between the service provider to the service recipient is not adequate, if we are honest, especially for the public sector. Then we also have varied literacy. So even if we have some of those digital innovations, especially when you look at rural, urban, it is not distributed evenly. And I think that was what was mentioned earlier by one of our speakers. Then when we look at our labor market, it's a little shrunk. For certain technical skills, people who are relying on the formal labor force, those jobs seem limited. So those are some of the challenges when we start to think of integration. And then finally, we don't have very strong regulation for digital, within digital, the official formal workspaces. We don't have strong regulations around digital practices. So I'd like to propose really quickly what could be an entryway, especially when we are thinking of young people. I think this one font-wise looks a little small, but I can just give you an idea. So in terms of education, I was thinking, okay, maybe we can improve digital education. Let's treat it like literacy. I was giving Beryl an example of when we were younger. Many of us must have gone through this. We were taught when you get to the road. So this is road safety 101. You get to the road and then look right, and then you look left, and then you look right again, and then if the road is clear, you do what? Exactly. That was road safety 101. That was road safety 101. So there's something about digital literacy that we need to do. The look right, look left, start from the basics. How do you identify a phishing website? For a young person, how do you know this is a bad website? How do you know this is a website you should input your own information? So there's something age appropriate that we need to tailor and start that for a very young age. And then you also have to teach the teachers, because if the teachers don't understand, then it becomes hard to support that implementation. And then now have school policies that actually facilitate that. Within the health space, I am proud to say that there's efforts that are happening. We already have digital tools. Maybe we need to do a little more in terms of, again, that rural, urban, because there's that inequity. If I go to a health facility in Karen Hospital, for example, maybe there's a digital screening tool for somebody who's young, but if I go to Lodwa, will I get the same quality of screening? And then integrating our approaches into that and expanding our telehealth opportunities. So for labor, and I know we'll talk a little bit about this later, I actually propose something along the lines of workplace readiness. So the same way we teach young people to write CVs and dress presentably and not write an email saying, hi, H-A-E, hi, sir or madam. We also need to teach them healthy work etiquette around digital too, so that this is how, not only this is how to respond to an email, take breaks, establish healthy boundaries within reason, and teach them that very, very early. And then, of course, in addition to the entrepreneurship training, then just creating a body of ethics around digital wellness. Now, how would we roll this out? I propose that we have a multi-sectoral discussion. This probably already exists because we do have multi-sectoral engagements that focus on priorities within the county or nationally. So within that multi-sectoral groups, come up with a tool that can actually assess digital wellness across the board. Then take those tools and pilot them. Pick 2-3 counties, pilot them and see, okay, so is this the problem we have in terms of digital wellness? If we provide this intervention around digital wellness, will it be helpful? Then if that works, scale it up. And if that's able to work, we go in and now we advocate for those wellness initiatives to be included in the policies that we have. So I think that was the main thing I wanted you all to know. If I was to give a call to action, I would just have it in 3 ways. 1, those silos. If if you think of digital wellness, we haven't decided who is responsible for it, but I think everybody is responsible for it. So ensure that those collaborations are done in a multi-sectoral way. Then if you wanted to understand, to create wellness, digital wellness programs or initiatives, you have to have ways to measure. And that's where researchers like from APHRC will be very good at developing assessment or metric tools that we can use to say, oh, this is our digital wellness index, and these are the practices that are actually working and are improving this index. And then finally, because my call is actually to young people, I think the youth need to be included in those digital design programs. And I'm actually advocating for a radical 33%. So a third of the youth should represent those kind of forums, so that you make sure when these things are being designed, they meet the needs of the youth, because we've seen the youth are actually the majority. So that's all I wanted to let you know in terms of Keynote. I'll say thank you.
Thank you very much, Sina.